Hi, welcome in. We're just gonna be right back this way. We'll be down this hallway here. And we're gonna be right in this room here for your preoperative visit with Dr. Simon or Jen. So today we're just gonna go over your current medications and all your allergies, all your current symptoms, and we're gonna review your labs, EKG, medical clearance, make sure you're all good to go for surgery.
Before any shoulder replacement surgery, a lot of planning goes into it beforehand. We see you in the office, we examine you, and we have imaging that is performed, such as a CT scan or an MRI scan. With that scanning, we then upload that to our software company and the implant company that assists us in preparing the shoulder replacement specifically for your shoulder. For example here, this patient has already been done and their surgery is upcoming, and we can move it and see exactly how we want the implant to fit. This is made specifically for you based on your specific anatomy, and we design it by looking at the size and the shape and construct it to make sure that every screw is placed perfectly and the implants are placed perfectly. Then we can see the final product before you even get to surgery, understand what's going to happen. So that many people will ask me, well, how do you go ahead and know what size I am? Well, this is how we know. We do it ahead of schedule, and this is planned about a week or two before you even have surgery. And we tailor it as we need to.
This is a model of a reverse shoulder replacement. The reverse shoulder replacement is more commonly done than a total shoulder replacement. And why is it called the reverse? Because the socket is now a ball instead of a socket. And the ball side is now a socket, so it's reversed. It is more commonly done because the rotator cuff fails as you age, and a total shoulder replacement does not accommodate for that. But a reverse shoulder replacement was made for a shoulder that does not have a rotator cuff. So this is commonly done as our most precise way for recovery as you age. And we've been doing it younger and younger patients. It was initially limited to people over the age of 70, and now we're getting even younger than that.
And let's meet our friendly staff at Posada Ambulatory Surgery Center.
Good morning. Welcome to Posada. I'm Anna. This is Kim.
They'll be taking care of you. They'll be asking you certain questions and making sure that your medical history is current. They're going to want to know your medications, your surgical history. They're going to tell you to wear loose clothing, bring your medicines with you, and be knowledgeable about your health history. Then they will have you fill out some forms and consents, as every place would. You'll have a seat behind you, and then wait for one of the nurses to bring you back.
And also, if you're having a total, you probably want to bring your walker or crutches with you.
A total means a joint replacement, such as a hip or knee replacement.
And be sure to have the name and phone number of your driver.
Yes.
And bring a smile on your face.
Well, my name's Becca. I'm going to be one of the nurses taking care of you today. This is where I will confirm your name, date of birth, and what we're operating on. And we just want to make sure we're on the same page on the side that we're operating on too. And then when we get through these doors, there's a chance to use the bathroom if you need to. I'm also going to confirm when your last food and fluid intake is. And hopefully you will say the night before and that you took your medication, any medications you took this morning too. And then this is where we are going to be today. There's 3 different bays. This is the pre-op area, but this is where you'll be today. You're gonna sign 2 forms for us when we get here. You're gonna sign surgery consent, and you're also gonna sign anesthesia consent. You are going to see 3 different people before you head back into the operating room. You're going to see Dr. Sima, where he's going to mark the correct knee or hip or shoulder, whatever you're operating on, he will mark it. And then you'll also see the anesthesiologist. So if you have any questions regarding anything, they'd be happy to answer. You're also going to see an operating room nurse who's going to be in the room with you. And then you'll get dressed into a robe. So you'll come on the other side, and we'll give you privacy, but this will go right over. You're going to be in it. We take everything off, okay? And this is going to be open to the back and over the head. You get a belongings bag. You get a party hat. And you'll ultimately get some socks and your leg compressions. Once you're done with surgery, we go over to the recovery room. And then after you get dressed and all ready, we will shave if we need to, or clean, and we'll clean the area with, I will show you. With this little scrubby. It kind of looks like an orange bad spray tan. It's the first scrub. They'll scrub you really well back there too, but this is just the first cleaning.
And they'll bring this back to...
Yes, everything's going to go under your bed so we won't lose it, and everything will be labeled too. So you'll make sure to take jewelry off, and if you forget to take it off, and if you have glasses, we have lots of things like envelopes we can put them in with your label. And then, yeah, and you'll also get an IV here too, okay? And then once you're all set and ready, then they'll roll you back into the operating room, and they'll do your surgery back there. And then whenever you're ready, the anesthesiologist and your operating room nurse will bring you into the recovery. This is where the anesthesiologist will do your nerve block, okay? And Dr. Sima will explain what that will all look like, as well as the anesthesiologist. But this is where it will happen, and then after that, they'll roll you back into the operating room.
Congratulations, you made it out of your surgery. We're in PACU. This is an area that we help you recover. We help you wake up. We'll be with you for a couple hours while you start to wake up, and you'll be really groggy. We'll keep you nice and cozy, and we'll monitor your vitals. We'll go over all your discharge instructions, and you're gonna wake up in a sling for that shoulder surgery. Your block is gonna keep it numb, so you're gonna not feel that shoulder the entire time that you're here recovering with us. It takes about 24 hours for that block to wear off. We'll go over how to do daily life with a sling. We'll kind of walk you through how you're gonna feel, get you up out of bed before we walk you out to your ride outside.